Call the meeting to order. As you are willing and able, please rise for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening. Thank you all for coming. We start with our opportunity for public comment. We have had no one sign up for that, so we will move right into the report of the secretary. And I will entertain a motion, please, to approve the minutes of our last meeting.
I move we approve the minutes of the regular meeting of Wednesday, November 16th, 2022.
I'll second. Jen?
Thank you, Jen. Comments? More questions? I read through them this morning. They look pretty good.
I just noticed one
Go ahead.
on page 2,
Mm-hmm.
number 4. The second to last line, Mr. Cavalli either stated that he and Mr. Cormier or just...
Oh, missing the word stated. Nice catch.
And then on page 3, number 8, where did I see that? There just was a missing comma. Oh, on the second line, boys and girls basketball, comma, ice hockey.
Oh, yeah.
That was,
Well, there's a new sport called basketball ice hockey.
And probably
Cutting edge.
girls should probably have an S.
Yes, boys and girls.
oh, girls,
Yes.
missed that, yes.
Any other comments? In that case, we'll bring it to a vote. All in favor? That's 5-0. Thank you very much. And that brings us to the report of the chair. I have 3 things to mention. The first being that our next meeting with our town officials is next Wednesday, the 14th of December at 8:30, and that will be hosted at the central office this time, I believe. Yes, so as we always do, I'll coordinate with you to make sure we have no more than 3 that want to attend. Okay. Just a very brief update on the Maine School Board Association. We had our organizational meeting last week. I'm now on all 3 of the standing committees, so as you watch things that come down from the Maine School Board Association, I'll bring things that are of interest to this meeting, but if you see anything, let me know. Okay, thank you. And then thirdly, we had a workshop earlier this week. About half of us were able to make it with our 2 state representatives, Representative Tiffany Roberts and Representative Michelle Meyer. At their request, they reached out and asked if they could meet with us, which I thought was awesome. Very much appreciated. They came and talked to us about some of the things that they think are going to happen in this next session of the legislature. We talked to them about some of our concerns. It was a really good, I thought, a really productive discussion. So, that concludes my report, and that brings us to the report of the superintendent.
Thank you very much. Just wanted to say, I appreciate everybody being here. We have talked about the Maine Integrated Youth Health Survey, and 3 years ago, we brought that information to the board with a formal board presentation to kind of go over what the data says, and that is a instrument that's given to students every 3rd year. And so I am happy tonight to be able to introduce Sally Mannanen and Gina. Is Gina with you?
Yep, I'm here.
All right, okay, perfect. No, you sure are there, okay. Okay. And they're going to take us through our particular school data, which is also normed by the state of Maine. I want you to know that we've had this information for about 6 weeks. We've already begun to address some of the concerns that we saw, and certainly want to be able to share the information. This is an opportunity to grow. And I'm going to turn this over to Sally. I am sure when you are done with the presentation, you'll have a multitude of questions, and so there's plenty of time for that. This is probably going to be about an hour, just to feel that there's a lot of information here. So, okay, without further ado, we turn this over to Sally and Gina.
Thanks so much, John, and to everybody at the school board. Can you hear me okay?
Yep.
Yes.
Okay, good. There's a teeny bit of an echo, but I'll ignore it. I'm Sally Mannon, and I've met a lot, if not all of you, 3 years ago, unless you're new, and then I haven't met you. And thank you, John. You've been, you and the rest of the Marshwood staff are great partners to work with in prevention. And I'm the director of the Community Health Department at York Hospital, Gina. And you all know Gina, but Gina, go ahead, just in case they don't know you.
Hi guys, I'm Gina Brodsky, prevention specialist and program coordinator here at Choose to Be Healthy. Prior to that, school counselor and a substance abuse counselor for 15 years at the high school level.
So as John said, we're going to go over as quickly as we can the results for Marshwood Middle School and High School from the last survey that your kids took in February of 21. This is just the first of hopefully many conversations. And as John said, they've already been looking at it and are already working on different aspects of it. And we know that you have been working on a lot of these health issues for quite a while. I just want to say real quickly, if you did get a handout, it's going to look slightly different than what you're seeing up on the screen, only because I made some changes at the last minute. And whoops, go back, don't do that to me. Thank you for being flexible and letting us do this from Zoom. We really appreciate that. I know it's not the best way to do it, but we're trying to stay healthy and follow policy at the hospital. I just want to thank you all. I don't know if you remember this, but when I presented to you the last time, the 2019 data, a couple of you said, you know, you were very welcoming, and you said, you know, why don't we have a coalition for the Marshwood communities? And I said, you should go for one of these grants that we've gone for, these federal drug-free community grants. I'd be happy to help you. And then the pandemic hit. Well, I went ahead and wrote for the grant, and we got it. And it benefits the Marshwood communities, the York communities, and the Kittery communities. And we couldn't have gotten that grant without all the work that you do with the Wellness Committee in the schools and in the community. So I just wanted to say that. We can talk more about that at another time and what it means for Marshwood. And that just says a little bit more about it. I won't read that slide. And that is a real quick down and dirty what we do in prevention, build protections, reduce risks. I'm not going to go into that. As John explained, we do the survey every 2 years. 2 years, 3 years, 2 years.
2 years.
2 years, right, 2019, yep. 2021. And it's just a snapshot. So don't think of it as the be-all and end-all of all the information about what's going on in your school or in your community, I should say, because it does cover a lot of things that don't just happen in the school. And I'd be happy to present this data to your parents and to your youth as well, because this is not just school data, this is everybody's data. However, the information is valid, it's reliable. I think a lot of you know kind of the statistical strength behind it. We have results over the years to see the trends. We compare it to the state. It's a really good way to track youth health, to evaluate things you're doing in the school, for us to evaluate things we're doing in the community. Like I said, it helps us get grants like the one we just received to help your communities. And we hope it's the beginning of many conversations, as John has already said it is. I also want to just mention, if you didn't realize, it covers pretty much all the health issues, not just substance use and mental health, but that's what we do at the coalitions, Choose to Be Healthy and the new Youth Resiliency Coalition. So tonight we're focusing on those questions. These are some tips that I would recommend, just some real basic ones on how to look at the results. You know, what are your numbers doing? They getting better? They getting worse? Are they a lot different than the state? That is a story right there. Why are they different than the state if they are? Is there something going on that you can dig deeper into if you see something that concerns you? I think the data is a really wonderful way to talk to the kids in your schools and the staff about what's going on, to ask the youth, does this match what you see amongst your friends? What did you think when you were answering these questions, et cetera? And to get a team approach to it, which I think John has certainly been encouraging from what Gina and I know. We wanted to start with the positive here, because there is a lot of concerning data in your data, as there is across the state and probably across the country, certainly with mental health. But we want to start with positives, which is from 2009 to this most recent results. The trends are all positive. The numbers are going in the right direction. And you can see this is past 30-day use amongst Marshwood High School students in what they reported on the survey. And you can see, especially with prescription drugs and cigarettes, we've made huge strides as communities, as parents, as prevention specialists, as schools. And so that's great, and that really shows that prevention works, that education works, that we can do this when we really put our minds to it. You can see with marijuana and alcohol, while the trend is, with alcohol is positive, the trend with marijuana not as positive. But that being said, I think considering all the retail marijuana outlets that are in the South Berwick, Elliott area, Kittery area, I'd say that's not bad, to be quite honest. And in my 20 plus years of prevention, it seems like there's always around 24% of the kids doing the most popular drug of choice at any one time. And I don't know if you want to take a minute to have any questions here or make any comments, or should we just keep going and wait till the end? John, what do you think?
It's up to the board. I did not share the information, the PowerPoint with you. I'm emailing it to you right now.
Oh, okay.
Perfect.
Just, I just think the one thing I think is just important that we might
Yes.
just touch on is the timing. That this
Of the-
was November of 2011 was when we did
Yes.
this. So just, I want to set
21.
21, sorry.
Yeah.
Yeah.
All those together, so just give you the setting, coming back off the pandemic. I think
Yep.
back to November of last year, the real difficulty around whether we hold a prom or not. Do we have the balance between the social emotional health versus the physical health? Do we mask? Do we not mask? So just kind of like remember that November time, that was an interesting time across the country. And so just wanted to be able to say that that's when this was given. So
Yeah.
just that those are kind of the environment.
Thanks, John, for talking about that. There's a lot we could say on all of this as we go along, and forgive me for rushing. Yes, we need to think about the fact that the survey was given at a different time of year. The circumstances were, crazy on many different levels. And as you look at your data going forward after tonight, you want to think about all those things. And when we get the data for 2023, that will be a real good test to see, how much of this was because of the pandemic or not. And I think as we go through, you'll see that unfortunately the mental health numbers are not so great, but they weren't anywhere in the country, and amongst adults either, for that matter. But the substance use is perhaps not as bad as you would think. So there were 2 questions that they added to the survey because of the pandemic. So I just wanted to share those. Was school work more difficult? And was your mental health poor most or all of the time? And so as I go through the slides here, I tried to be consistent with the colors. So these are the colors for your middle school compared to Maine middle school. So the orange is your middle school compared to the darker color, which is Maine middle schools. So you can see your mental health, the kids reported maybe slightly higher mental health issues than the state, but a little less on the schoolwork being more difficult. And as we go through, when we get to a number that is significantly different than the state, I will point it out to you. Here's what the high school kids said to this question. somewhat similar to the middle school youth at Marshwood. Didn't think the schoolwork was as difficult as kids around the state did, but a little bit worse on the mental health, being poor most or all of the time. And besides all of you interrupting with comments or questions, Gina, because you have insight, especially into Marshwood, feel free to jump in as well. And let's see, so the next one, past 30-day drug use. And this is, the question is worded, have you used this substance one time or more in the past 30-day use? And that's the question, the indicator we use for current drug use. So prescription drugs, cigarettes, marijuana, and alcohol for this slide, middle school compared to the state. And here you see that Marshwood does better than the state. And so, as you all know, kids in middle school thankfully tend not to be doing this, any of these unhealthy behaviors. But when they do, the Marshwood kids were doing it at a far lower rate. Though you see it was 0 for everything except for alcohol. And we can talk about that later. Gina and I are concerned in general with the fact that we feel that perhaps in the past few years of paying so much attention to opioids and marijuana, perhaps we haven't been focusing on underage drinking as much as we should. So we're going to be actually meeting, having a coalition meeting next week about underage drinking prevention.
Can I ask a
Of
quick
course.
question? Sorry. Does cigarettes, does that also include vaping when they were given the survey, or is that separate?
That's separate. Good
Okay.
question, and that's
Good
all.
job. Someone's paying attention. Let's give her a gold star.
Okay.
Give that woman a candy. So yes, we will talk about that in a minute. That does give us some more insight into nicotine use specifically. So here's your high school, Marshwood High School past 30-day drug use. Again, very low for prescription drugs and tobacco, which is great. It wasn't always that way. If you look back at the trends, the prescription drugs were quite high back in 2009. But the marijuana is higher than the state at 23%, and the alcohol is higher than the state at 25%. And we found in other schools' data that we've started looking at in our area of Southern York County, that in other high schools, the marijuana and alcohol use was not that high. And so this one to me is interesting, and it would be a good one for folks at the school to think about and in the community. Because we know, first of all, I'm used to doing these presentations when there are parents in the room, so forgive me if I'm talking like I'm speaking to parents, but we know that most kids are not doing any of these unhealthy behaviors in the school. They are doing these unhealthy behaviors, if they are at all, in the community and at home. So I really want to make sure that you understand we by no means look at the school as the problem.
And there's a whole bunch of factors too, because of perception of harm, with the legalization of marijuana, with the increased access to marijuana. We find, regionally, where are the, like Sally said, there's been such an increase, especially in the South Berwick area, of marijuana shops and what have you. So perception of harm is an issue.
And access.
Right. Not perceiving that it's harmful, and having adults who have more marijuana accessible to them increases access to youth.
And so I'll just say real quickly that York, for instance, which only has one retail outlet. Now that doesn't mean that we don't have plenty of marijuana, I'm sure, in York, but there's only one retail outlet. And the marijuana use amongst high school students was less, quite a bit less. So it's just interesting. We want to see how much access has to do with this. And then back to alcohol, the 25% you see I've got there in bold because that means that the underage drinking in the Marshwood communities is significantly higher than the state. And that's figured out by the state through their formulas for confidence intervals, et cetera. So just to remind everybody, we're presenting the data. We didn't analyze it at the state level. We're given the data because of your generosity in sharing it with us, and then we present it in a way that is hopefully useful.
And one possible reason for the alcohol piece is there was a great increase in alcohol sales across the country during the pandemic. And again, I wonder about increased access and opportunity with everybody being at home. And we know that the number one place youth get their alcohol is from their homes.
Is at home, that's right, and not from the local store. That just isn't how they get it. Right. So the vaping, back to vaping, as somebody asked earlier, and I'll just explain, this is for the middle school now, where fortunately they're not vaping very much. So 2% of your kids, which is significantly less than the state, 4%, reported vaping. So 2% of the middle school kids reported vaping anything. They just reported that they were vaping. Then they drilled down. Of those kids that said that they vaped something, half of them at the state level were vaping nicotine. 12% were vaping marijuana. The reason that there's no data for Marshwood is because that question wasn't asked of your kids, but it was asked on the state level. So basically what I'm showing you here is that thankfully your middle school kids aren't vaping very much, but when they do, they are probably doing what the kids in the rest of the state are doing, which is by far, most of them are vaping nicotine. Does that make sense? And then this 12% vaping marijuana, and then the rest of the percentage is some unknown, they might not know what they're vaping, or it might be just flavoring.
You choose, right?
So then when you get to high school, again, well, not again, I shouldn't say that. So at middle school, you were less than the state, but then at Marshwood High School, now your numbers are higher than the state. So 23% of your high school kids are saying that they vaped something in the past 30 days. And again, unfortunately, the question wasn't asked, what were you vaping? But at the state, 60% were vaping nicotine, 25% vaping marijuana. Now, to be honest, I'm kind of surprised at that. I've always thought that kids who vaped were perhaps vaping marijuana more often than nicotine. But the data is saying no, most kids are vaping nicotine. So while we can be proud that we got our cigarette use down, we do need to be concerned about nicotine getting into our kids via these vapor products. Whoopsie, I went too fast there. So now we're getting to some of these other perceptions. I hope you can see the titles of these slides because they're covered by my thing here. This one looks at, do you think marijuana is not harmful? And do you think it's easy to get? And so as Gina said earlier, these are concerns for us as prevention specialists. If kids think something isn't harmful, they're more likely to use it. If they think it's really easy to get, they're more likely to be able to get it and use it. So the good news is with the middle school kids, something's going well here around the issue of marijuana. Significantly fewer of them think it's not harmful. So meaning more of them think it's harmful than the state, quite a bit more. And a significant number less think it's easy to get. So even though the Marshwood communities have a lot of retail marijuana, the middle school kids seem to be not affected by that. Now at the high school level, the story changes. So now, whoopsie, now we see that, whoops, sorry, went back too far. So now we see the high school kids, almost 70%, think that using marijuana 1 or more times a week is not harmful, a little bit more than the state, and about the same almost half of them think it's easy to get. So there's something going on, you know, in maybe developmental stages. We want to hopefully see in the next survey that our middle school kids aren't also saying that it's not harmful and that it's easy to get, because we might then hypothesize that it has to do with their experience of the many retail establishments. So these are the same questions around alcohol. Think it's not harmful, think it's easy to get. Middle school kids, none of them thought that it wasn't harmful. Oh no, pardon me. In that case, it means that that question wasn't asked of the Marshwood Middle School, not asked. But 38% in Maine think that drinking 1 or more times a week is not harmful. And about 30%, 32 compared to 34, think it's easy to get.
Sally,
Because it's, yeah, John, it's annoying. I hate when that
It is.
happens. Because what happens is the state has different versions of the survey. And to get, I don't even know why they do that, but it has to do with,
Reliability, I believe.
no, this different versions has to do with the sampling. And so they have a random survey that goes to different schools, and then when they weight the data for the county or the state, they have different demographics and geography to weight. And so sometimes our schools get a different survey than another school system. And it's not because you chose a different one. And the state survey is always the one that has all the questions on it. So sometimes we have good state data or county data that we just don't have at the local level, which is annoying. So, so same questions. I think I already said this one about alcohol. Yes, I did. And then here's, so here's the high school kids. You know, almost 40% think that daily alcohol use is not harmful. That's concerning, especially when you consider the fact that there are new drinking guidelines where basically doctors and researchers saying any alcohol is unhealthy. And people just have to decide how much risk they're willing to take. And so anyway, so that one is a concern, but not dissimilar to the rest of the state, as you can see, and not dissimilar to other schools in our area. You folks are a bit higher in the easy, we think the kids thinking it's easy to get. And as Gina said, most kids are getting it from a social source. There is a question on the survey that says, where did you get the alcohol that you drank last? And by far, most kids say, someone gave it to me. And so it's not that kids it's not that our stores are doing a bad job and selling to minors, it's that legal aged kids or adults are providing intentionally or unintentionally to young people, or it's simply in the home and it's not monitored. Let's see, so yeah, and whoopsie, interrupt me if you need to. Let's see, here we are at, oh, sorry, other risk factors. So, whoops, did I skip the middle school? What happened there? Oh, well. Oh, some of these questions might not be asked at the middle school level. So this one, there's a couple of concerning ones here to me, the ones that stand out to me because they differ from the state so much, or they differ from previous years, and that's the first one in particular. So you had a significantly higher percentage of kids who said they were offered illegal drugs on school property. And I believe that's in the past 12 months is the way the question is worded. I should have put that on there. So 23% compared to 17. And then another one that adults addressing negative language and bullying at school. So this goes to the kids' perception that the school staff are positively addressing negative situations like language and bullying in school, and that was less than the state. bullied at school and bullied electronically was on par with the state. That doesn't mean it's good. It just means at least you weren't, much higher. I will say, I don't have a slide about it, but we have a lot of data on young girls and chronically at much higher rates than the rest of the student population. This was an area where Marshwood does really well at both the middle school and the high school level. The kids say they feel safe at school. And we know that, we're very fortunate in Maine, knock on wood, the kids feel safe at school. For the most part, they feel loved in their homes. We've got a lot of really positive assets and protective factors in our communities. One of the newer questions that the survey has been asking, the past couple surveys anyway, is about ACEs, which are, I believe you all know about, perhaps from other workshops or the last time we presented adverse childhood experiences. It's a really interesting research study. It's still going on with tens of thousands of adults. And the researchers looking at correlating their mental and physical health as adults with how many adverse childhood experiences they had. And if you,
like divorce, trauma.
yes, thank
I'm
you.
just trying to put out a couple examples out there
Yes.
for folks.
Yes, some of them are, pretty common, like divorce or death of a loved one, families with substance use issues, families with mental health issues, homelessness, food insecurity,
Sexual assault or abuse.
sexual assault. There's a list that the kids check, and so unfortunately, Maine as a state had the kids reported 4 or more ACEs. 21% of them reported 4 or more ACEs. That went up this year to 25%. Perhaps not surprising given the pandemic and how it exacerbated so many other issues. Marshwood stayed at 21%, still high. And I've heard data of folks that are more familiar with the ACEs that Maine is actually higher than other parts of the country that look at that number. So mental health, as I said, the mental health indicators are unfortunately, they're not good for any age group across the country. And we all know, you probably know, we've seen mental health as an issue amongst our young people for quite a while now. Our teachers talk to Gina and to myself about, and our counselors talk about seeing more extreme behaviors, more severe problems, more need for services, et.cetera. And this is across the board. It's not specific to the Marshwood communities. I just want to put that out there because I know this data can be a little somber and a little overwhelming at times. So one of the questions is getting at depression. It asks if they felt sad or hopeless every day for 2 weeks or more. So much so that they didn't do things that they usually do and like, etc. For the middle school kids, the question was asked, have you ever felt this way? And about 30% of them, just like the state, said yes. Now, good news, bad news. Bad news is that any middle school age student is considering suicide, but at least it's significantly less than the state level. Still, unacceptably high. We would all agree on that.
And just a quick check in
go
here,
ahead.
folks. You guys can, if you have any questions or thoughts as we go along, you might want to jot them down. We will have time at the end for discussion. We just want to make sure we get all of this in. And we commend you for hanging in there. We know that this is a lot. And, data is great, and it gives us a lot of direction and conversation that's valuable, but it can be a lot too, and we understand that.
Thank you, Gina. I'm rattling away here. And so for the high school, the mental health data, there are a few more questions. The middle school kids don't get asked quite as many questions. So now the depression question is not for lifetime, it's for past 12 months. And this one, the number is significantly higher than the state. And then of those who said they felt depressed, 25% of them, similarly to the state, said they got help from an adult. And we know that most young people don't get the help that they need for their mental health issues, period. Now, of the kids who said they were depressed, 2% of them got help from school staff compared to the state. Now, this is one that, and then I'll go back to that. And then, unfortunately, this considered suicide in the past 12 months, Marshwood is also significantly higher than the state. If you do look at your, I gave John a handout that shows all of the questions over the period of time from 09 to 21. I can pull it up here in just a second. These numbers are actually improving. They are just really not good right at the moment, especially that 45. Let me just go back and say that the one about getting help from school staff, I think is not telling the whole story, because that question, the kids are only allowed to choose one answer. So I actually talked to the people that do the survey today, and I told them I think they need to change their question, because I think the kids are not able to say, I got help from an adult, and oh yes, I also got, an adult outside of the school, and yes, I also got help from a school staff. They're being forced to choose, and the answer choices aren't very good. So anyway, still it's not really good that only 25% of them got help from an adult. And Gina and I have been working quite a bit with school staff, counselors in particular, on how to just make the kids know who they are, that they can talk to them, that they can, schedule time to see them at any time, et cetera, and just to build those connections within the school. Let's see. So here's some protective factors for the, whoopsie, I keep doing that, for the middle school age kids. Again, like I said before, you have some good protective factors. In all of our communities, we have really good protective factors. So over half of your kids feel like they matter to people in their community. 75% say that they have one or more teacher that helps and supports them. And a really big percentage, almost 90%, say that they have a family that gives them love and support. And at the high school level, the numbers aren't quite as positive. So again, it's easy for me to say I don't work in a school, but I do feel like there is a disconnect between how the environment of a middle school and the environment of a high school. There's
Developmentally too, developmentally
right.
different.
I was just about to say there's a big reason the kids are different, but I think there's a big change in how we treat the kids, whether as parents or community members or professionals, and I think it's borne out here. So when you look at this data, the high school kids are not feeling like they matter to the community as much. Fewer feel like they have school staff that care about them. Quite a bit fewer than the state feel like they have one or more teacher that helps or supports them. Again, they still have good support at home, but then fewer have support from other caring adults, which we know is a protective factor. I would say that one of the reasons for this, a lot of this may very well have to do with the pandemic, especially if your kids were not in school, in the community doing some of the things that they normally did, where they would experience some of that support from other caring adults where they would feel like they mattered to people in the community.
Sally, I think the other thing I think it's important to point out is that I would be curious is if how you managed the pandemic impacted those numbers.
Mhm.
You know, so I would remind, we're going back to a time where every study hall was 6 feet apart, everybody had an assigned desk. I mean, you know, so it was very, like, you know, very safety protocol driven, as opposed to maybe other places handle those things differently. Elementary school may
Yep.
have looked a little bit different, so
Yep.
that's an interesting factor that I think
Yeah.
to be looking at.
It is hard because the data, it takes time to compile and collect and everything. And, you know, this is from February of 2021. So, you know.
November of 2021.
November of 2021. Yep. Which is, you know, it's
And I also
it be considered.
remember talking the first meeting in March and just the feeling when we lightened the pandemic. You know, with people could sit with their peers at lunchtime. You know, you could palpably feel the difference. And so that's what makes me think of that. So just there's moments in time that are kind of burned in your brain, and that's one of those. So that would be just a question I would have as well.
And I think you're bringing up, like we said, if we had lots of time to really talk about this and dive deep, which I'm sure you're doing in-house and with the kids and with the staff, there's a lot of reasons that some of these negative numbers might be happening. Some that you can do something about, and some you may just feel like you're doing all you can do, and you're just going to wait and see if the next time around the numbers look different, and just keep up what you've been doing. And Gina, as you know, has been working with your school system on a few different assessments and ways to work on different issues. And so she and I put this together, and Gina, I'm going to let you take it in here in a second, but I just want to say that we kind of brainstormed, like, what would it look like if every school, just made sure that they were doing everything they could to address mental health and substance use specifically. And we threw this list together, which I think is pretty complete. And I know from what Gina's told me and from what John's told me that your Marshwood schools have a lot of these things in place. So we threw this together for any school to kind of look at and say, how are we doing? But you go ahead, Gina, and talk about this with the folks.
Right. I mean, this is what the ideal looks like. This is a comprehensive approach to school wellness. It would be a coordinated approach to student and staff wellness to make sure everyone's doing well. That would be, the motto. And John, I think you started this well a bit ago, connections over content. Those words are really powerful and important. And I think we have to realize that in 2022, education is different. It just is. We can say, well, when are we going to get back to the basics and reading, writing, arithmetic, and all of those things? But the fact of the matter is, 2022 education looks different. And we know that if students feel well, if staff feel well, they're going to do better across the board. So evidence-based curriculum, current consistent policies that focus on compassionate consequences. A lot of people listen to Sally and I and think, oh, they're saying, don't suspend kids, keep everyone together, don't have consequences. No, have consequences that are compassionate, keep kids in school, and helps to let them grow, because kids screw up as part of growing up. Partner with staff and students and the community on wellness, which John, again, Marshwood has done really well reaching out to Choose to Be Healthy, your local coalition. But looking at all your community assets and partnering as much as possible, because we know that prevention and intervention takes a community. Universal screening for mental health and substance use for your students, if at all possible, across the board. Screening for their mental health and substance use patterns to help identify kids who need service is important. All staff trained in basics of identifying youth in need of service, so like mental health first aid, for example. Counselors, social workers, and nurses trained to identify and work with and refer kids if necessary to outside entities. And quite frankly, most youth don't require referral out. They just require supervision, compassion, consistent relationship with someone that they can trust, to talk through whatever it is they're going through, whether it's academic, social, mental health, substance abuse. And then a school-wide consistent formal process to identify and support youth who are struggling. Sometimes some schools call that an SAT team, a student assistance team, or a MTSS team. But those are the pieces that when we're looking at data like this, which this data really provides a great opportunity for conversation. Not just like us presenting to you guys, but having conversations with parents, having conversations with faculty and staff and your students to talk about this, talk about the data as a community is really your best bet. But a school-wide consistent formal process to help identify youth who need more, who might not be doing well, who need additional support is really ideal.
Gina, can you just touch on real quickly the work you've been doing at Marshall Middle School with the you're doing with York and
The Mattering Project?
Yes, please.
Sure. Well, a couple things. First, I've really found my lane, I think, with Sally's awesome support at the Choose to Be Healthy Coalition, supporting school counselors. It's easier to do that. They tend to listen if you've actually been a school counselor. And so that's been really great. We have school partner meetings with, we invite the school counselors of all of our schools to come and to learn and to talk and to grow and to check in together. And Marshwood has really, especially in the past year, been engaged with us and reaching out for ideas. We decided that we wanted to do a Mattering project because in 2019, prior to the pandemic, we got data, my house data reflected that almost half of Maine youth, so across the state, didn't feel like they mattered, which was very concerning to prevention specialists all across the state. So we have, since 2019, have been having this conversation and have been developing projects. So most recently, the Choose to Be Healthy Coalition has gone into middle schools and high schools of our school districts, York, Kittery, Wells, Marshwood, Noble. We focus so far on York, Marshwood, and Kittery. And we've gone into classrooms. We were happily welcomed. I mean, Marshwood was like, pick us, which was awesome. At the middle school, we met with a group of 56 middle schoolers in your gym and talked to them specifically about mattering. What does it mean to matter? Who makes you feel like you matter? And how do they do it specifically? And how could they improve if you're not feeling like you matter? In your school, in your community, in your peer group, and at home. And so we had a really great conversation with them. We've compiled the data. I'm actually typing up data right now from trade, like literally they wrote all over pieces of paper and we're typing it all up. And we got some feedback from the students on how we should take that information and either turn it into a brochure, a website. I did type it all up from Marshwood and I sent it back to your school counselors. And I'm so proud of them because without us doing the encouraging, like, hey, you guys gonna do something with this? They're already all over it and applying it in their SEL teams and having conversations with staff and students about mattering, which is awesome. It's just, that's great. So you guys should be proud of that.
And Gina, you typed those up. Maybe you could share just a couple to give them an idea of some of the things the kids said that would help them feel like they matter.
Sure.
I mean, in another school, not in a Marshwood school, we had young, if you used my correct pronouns.
Yes. I actually have a school right now. Do you want me to pull
Yeah, just say a couple of them, just so they get an idea.
I feel like I matter in school when my art is up on the walls, when I help someone else, when people allow me to ask questions since I'm from another country,
Oh.
when teachers give me feedback on assignments. One multiple response, happened quite a bit was when my teachers ask me how it's going, or when they intentionally check in, when I'm in the hallways and someone says hello. Those were said multiple times. Another example, I feel like I matter in my community when I go to work and people say hello, when people wave at me, when store workers are helpful and don't find me annoying. I feel like I matter at home when someone folds my clothes after they're washed. Oh my gosh, they notice. When I help a sibling and they say please and thank you. When my mom says she loves me. I mean, how many adolescent kids do you think say that out loud? They wrote it out.
And
Yeah.
I was just going to say, Gina, not to cut you off, but just it was really heartwarming to hear what they said, but we share it with loving kindness because we want you all adults, not just school professionals, but communities, parents to know, this is easy stuff. We can all do this, right? We can all help kids feel like they matter. We could go on and on about what mattering means to mental and physical health, but basically research shows that it has a huge impact on a growing child's mental and physical health if they feel seen, heard, and valued.
Yes.
And in all of the classes that we visited at all the different schools, it was unfortunately really obvious to us the kids that didn't feel like they matter. And I think we just all need to do a better job of showing these kids that they matter to all of us. So it's been really nice to do, and we appreciate Marshwood's efforts to do something with the information. And I guess we'll let you ask questions now because we've got a few more minutes, but that's our info. Those are our websites. We're busy, and we appreciate so much that you invited us here tonight, that you were flexible with us being remote. I particularly appreciate that. And so anyway, thank you. And let us know if you have any thoughts or questions right now. That'd be great.
I have one. The data in the charts are all aggregated by building, basically. So you've got all 4 grades of the high school aggregated together. Are the raw data behind that separated out by grade level, and was there anything interesting there?
That's a good question. I wish it was, and
Okay.
it's not.
Okay.
And I
He gets
have
a gold
asked,
star too.
I've asked, I think at the state level it is, but not where I've seen it recently.
Okay.
I've asked the statisticians at the state if they could do that, because it would be really helpful for prevention folks and for schools, but they just don't do it. And a lot of our schools are so small that when you get down to the grade, you're like under 100 kids, so then they worry that it's not as reliable or valid. But it's a good question. We do know that kids in general, sorry, I keep using the word kids, I'm just used to using that word, but young people in general, 9th grade is a really stressful transitional time. 10th grade, you start to see some more of the unhealthy behaviors.
Because you're not the new kid on the block and you're stuck in the middle of waiting for something to happen.
Right. 11th grade tends to be not as bad because my hypothesis, this isn't science-based, my hypothesis is they're all concerned about going off after high school to perhaps to college. And then in 12th grade, you tend to see more negative behaviors, especially around the legal drugs like alcohol, marijuana, and tobacco, because the 12th graders have more access. So those are the patterns I've seen in the past in larger samples of data.
Thank you.
I have a question. Was there any correlation between mental health and substance abuse?
Oh, that's a really good one. We don't have correlations like that for your school specifically, but yes, there are lots of correlations. And I will see if the latest data, the state does these really nice graphic handouts where they show the connections between mental health and substance use. At the high school level, I don't know that they do middle school. And if they've done the one for 2021, I will make sure that John gets it. Because they just put a bunch of new data out on the web, which, by the way, I should tell you because it sounds like a lot of you are really into data, which is wonderful. you can go to, I won't be able to do this fast enough, but it's easy to remember, SEOW.
I'll put it in the chat.
Don't,
SEOW, got it.
I don't remember what that stands for. I should know. And so it's Maine, SEOW.com. And let's see, if I can share this real quickly, I will just show you the screen. It's a really good website. I was just at their annual meeting earlier today. And if you look through here, you will see all kinds of data. And here we go, fact sheets. Can you see that, Gina? Am I on the right thing?
Yep, you're on it. Yep.
So, for
This
instance,
is excellent.
so here you go. Here are the ones that I have not even downloaded yet. They just came out. So we've got mental health and substance use among young Mainers, trauma and substance use among young adults, substance use in Maine specific to marijuana, housing insecurity and substance use, so correlations there, alcohol and the pandemic, and you see it goes on and on. Here we go. Here's the one you were probably thinking about, mental health and substance use. And so you can download any of these. You can, Gina and I use them all the time. And so here you can see can you see that handout, Gina?
Yep.
You can see some of the correlations. This might not be, what age group did they look at? Oh, good, high school students. So they correlated adverse childhood experiences, which remember, as Gina said, is basically a trauma of some sort, have higher rates of past month alcohol use, depression, and seriously considering suicide. So they're basically, Gina, correct me if you don't agree with this, but if you have an adolescent with mental health problems, they probably also have substance use problems, and vice versa. If you have a kid who's using drugs regularly, they probably also have a mental health problem, and vice versa, because they just go together at that age. And so that's why Gina's doing a really good job at developing some tools and some trainings for your counselors and all the school's counselors on how to talk to kids about mental health and how to talk to them about substance use. You can't just say, oh, I only talk about mental health, or I don't do, it's all connected. It's all connected to wellness and success in school. That was a big soapbox, sorry.
I did have one comment. This is Lisa. First of all, this could be so depressing on the one hand, and on the other hand, my brain is like exploding right now with possibilities, and I think there's so much opportunity here as well. One thing that I was thinking about is we were talking about grade levels and all of that, and how tricky it is sometimes, those transition times. And I'm just so proud of our school district and Mr. Caverly and his leadership that's a big area of focus for our school district right now, is making sure that those protective factors are 100% in place for those transition times and making that a little bit easier for students. The other thing is, we just had a wellness committee meeting right before this. I think Gina's, Sally, I think you've been to one. I think Gina's been to one in the past. It's been a while, but we were so excited to get this data today, and we had a really successful, almost like a parent informational night around anxiety last month, and we were
Yes, you did. I was there.
Oh, you were there? I'm sorry, I wasn't. So thank you.
I was blown away by your level of parental participation. I am really in tune to what it feels like. Is it a welcoming, okay place to ask questions, to go up to tables, to get information? And it felt really good and impressive. It was like the airs were gone. People came up to the table, and we had a bunch of resources, and they really went there and asked tough questions about mental health and substance use, and took resources. Whereas in other environments that I've been in, they'll like glance at the resources but keep walking because they don't know if anyone to see them taking the resources. That was gone. That was not there. I was really impressed, and you guys should be proud of the turnout that you had. And it screamed to me, they want more. They want to have conversations like that. And like you said so eloquently, it really is an opportunity. You can get really bummed out and sad, but how great that we have this data, because some states do not, and that we can have these conversations to improve as a community.
Right. I mean, at the end of the day, I don't think there's a parent out there or a staff member out there or an adult anywhere in our community that doesn't want to help kids, right? Like how do we come together and do this? So I was excited just thinking about that because we were brainstorming, okay, what's the next topic? What else are we going to do? What else are we going to do? Because we want to keep that momentum going. Like you said, it was such a success, and I think people are really wanting it. And I have to tell you, this Mattering project is just, it's universally, I think it's so eye-opening and so accessible, I think, to everyone, for that to be kind of almost a community-based project and not just a Marshwood Middle School project. It could be one of these parent nights. It can be a staff thing. It can be some of the focus group stuff that we were talking about before. I think there's so much opportunity just around that one topic that at the end of the day, when you feel like you matter, that's the biggest protective factor out there. So we could start with that as a district and just like blanket everything with that idea and develop a common language as a community. I love that.
I love that.
You nailed it.
That's the idea. That was the concept. And I have to say, Lisa, thank you for, being such a cheerleader. And I'll just reiterate what I said at the beginning. I'll try to be brief in saying this. The reason we got the federal grant that we got was because I was able to talk about the wellness committee at Marshwood. Because one of the questions on the grant proposal is, are there a group of organized people working on substance use prevention? And I said, yes, and this is who they are, and this is what they're doing. And then Gina and I put into the proposal that we were gonna work on Mattering, and that we were gonna work on reducing access to alcohol and marijuana. So we talked about the negatives. We're in an area with a lot of marijuana retail, but we're also in a community that has a lot of capacity. So that's what you're speaking to. You guys have the capacity and the resources to, go for it with Mattering and with, working with Gina and your counselors getting more trained and focusing on mental health like you have been for the past several years now. So yes, yay.
And this really goes back to a lot of the work that we've talked about. Right? I mean, obviously this is very concerning information to get, but it's not information that any of us really are surprised by. And just really the data affirms what our concerns were. And so what does that mean for us to be working on this? What does that look like? So we go back to our school council work that we began last year. That needs to be the hub of Mattering in our schools. They need to be the social emotional learning experts in our schools. And so how do we change that culture? Working with a staff, have Brett have this faculty meeting with this high school staff and say, 66% of our students feel like there's an adult in the building where they matter to, basically, paraphrase the question. That's different than it was 10 years ago.
Yeah.
Let's talk about that. And for some staff, it might be, what does it mean to be connected? Because a child maybe gets an A in a class doesn't necessarily mean they feel that connection. Right? And so let's talk about that. And so they're having some great conversations, and I think it was November 4th, Professional Development Day. There's a lot of time spent on that. And 5, 6, 7 staff members coming up to me at the end of the day, just thankful for the opportunity, hearing that data. What does that mean? And how do they reflect on their own practices? And you have to have the play it forward approach. It starts with one kid. That's what makes a difference. The universal screening stuff that we talked about. Panorama has that social emotional learning survey that's given to our students that actually now integrates with our MTSS program, so we can look at students' academic progress and also compare that to how they assess themselves about how they're feeling. And so those are the types of things. In the big picture, we're doing a lot of work to do, but I think that it's having these conversations. It's not running away from it. It's having the conversation in public to say, look, this is what it is. Let's talk about how do we build our goals around this going forward and being really specific about it. It's the wellness team getting together. It's our our health curriculum review that we're in the middle of right now, that we're talking about puberty in the elementary schools, to what do we do at the high school, what are we covering, what we need to cover, the bathing. I mean, there's a lot of this. So this is just the work that we're doing, and Sally and Jean have just been great partners with us. And just I really want to thank them for coming this evening.
Amazing.
Taking the time. So.
Thank you.
Thank you so much.
Well,
You're
just know
welcome.
we are waving our pom-poms for you guys, and we are so impressed. Truly, we're not just saying this. You guys are a very responsive partner in prevention, and you reach out, your school counselors reach out, they ask questions, they're willing to take things that we've done and then replicate them, which is really great. So we just feel really lucky to have enthusiastic partners in prevention, and clearly you guys have helped make a difference, because now we're funded partly because of what you were able to continue to achieve.
Well, because you guys applied for the grant, so thank you.
Sally is the grant. I can't apply for a grant if my life depended on it. Sally is the heavy lifter in this area and deserves a ton of praise.
Well, and so hopefully, Lisa and the rest of you, you'll realize that, we need to have many conversations about this. The grant just started. The work isn't going to end. We're just going to keep going. It's a 5-year grant, and there's state funding too. So we're here to help you for the long haul, for sure.
Much appreciated.
Great.
Thank you.
Thank you
Thank
very
you so
much.
much.
Yes, thank you. I would just
Happy
add,
holidays.
thank you.
Yes, happy holidays.
I would just add for our board to be thinking about, that there may be things that we can do as we enter into our next budgeting season, which is coming. This topic should be top of mind as we are looking at the budget.
Yep. Yep.
Woo-hoo.
And I don't mean
That's what we want to hear. Put your money where your mouth is.
Put our taxpayers' money where our mouth
Yeah.
is.
That's right.
And I
That's
don't
right.
oversimplify
Thank
it.
you. Thank you, folks.
Thank you.
Thank
guys.
you.
It's almost like the give a mouse a cookie approach a little bit too, is that, I remember reading that book, and you kind of this chain reaction. And so like at Marshall Middle School, just Kathleen Ring and Sarah Camp just running with that advisory program. And just saying, look, this is the time, this is what we want to do, here are some resources, and it's just,
great.
It's a needle mover.
Mhm.
And so like that, just really trying to make this a part of our conversation. This is what success looks like.
Yep.
Any other questions from the board? I'll screw all over my agenda, so hold on, sorry. I just wanted to make you aware that Rollinsford has reached out and tried to set up a second of our year. We have the two kind of joint board workshops. They would like to do January 4th to kind of have that next conversation. And that's really going to be around that data that we kind of started that conversation the last time we met. And so I just wanted to see if that makes sense. What we would do is a 5:45 to 6:45 session.
So we move wellness.
We'd move to wellness.
Move wellness.
Yeah, yeah. Does that seem to work for
Yeah.
everybody? Get back to me
I
on
think
that?
so, sure.
Yep.
I think so, yep.
Next is, I reached out to Governor Whitson. We talked about doing that we should do a yearly 1-hour executive session where we meet with our attorneys just to really kind of recalibrate around any changes in laws around school boards and the roles and responsibilities. It looks like the 21st, which is our next meeting, they could do that virtually. And so on the 21st, it would be our facilities and finance meeting would be at 5:15 to 5:45. And from 5:45 to 6:45, everybody would come here to be able to do that workshop. Does that make sense?
It does.
When we talked about that before.
It's valuable.
Yep.
That's awesome.
Yep.
And
That is so helpful.
I'm sorry to shuffle around the beginning meeting date. What I'm trying to do is that if Heather's on facilities and finance, and so she's going to be here anyway for those two things, let's not have everybody, let's not have everybody stand around for a half hour in between meetings. Let's just try to move
Right.
meetings around so that if Heather's going to be here for an hour and a half, that's okay, but let's try to really can move that meeting so that if Lisa's going to be here for an hour, she can be here for an hour. So that's why I do that, not just to confuse everybody, I promise. And just wanted to share that Laura Hofacker, who is a teacher at Central School, has resigned her teaching position at Central School, and that will be effective as of December 22nd. So I just wanted to share before that letter came earlier this week. So. two other things, as you know, there's a great deal of attendance issues right now in two of our schools. In particular, the high school is kind of right on that 15% fringe.
Yep.
Depending on how you do the math, I sent out the letter anyway today, but we're right on that fringe at the high school. But Marshall Middle School, as you know, has been over the 15% threshold, as well as Central School. It's an interesting conversation because I think there's a little bit of trauma left over from COVID. And so when you get those outbreak letters, it kind of triggers a bunch of different things for people. There are segments of our population who feel really strongly that everybody should be masking right now in schools, and that has come up with our nurses again. They have shared those concerns with me. I have shared with them our conversation that we had back where basically that we were moving forward, and that was not where we were at this point in time with masking or mandating masking for everyone. If that's still the desire of the board, I would reiterate that with the nurses. I did make a point of when I wrote my letters of adding that masking is welcome. People want to wear masks, they're certainly welcome to do it. At this point, we're not mandating anybody to do that. Although there obviously is safety benefits to that, but I think that's an individual choice. At this point in time, I don't, that was kind of where I stood. I just wanted to kind of get some feedback from the board around if they feel that we want to change that approach from where we are currently.
It was nice that you put a line about welcoming masks.
Yeah.
People wanted
Yes.
to in the letter.
I think it's really important that people who do choose to mask feel that they're welcome.
100%.
Yeah.
Yeah.
100%. Okay. I'll share that with them. They just feel like, obviously as medical professionals, that was their concerns.
Sure.
So that I would bring those forward. And we'll keep an eye on that as we go. There isn't a whole lot that we do. What happens when you have certain people out, that 15% is staff and students, and so
Yeah.
it becomes difficult to staff things. The tricky part with influenza with staff, though, is that with COVID, it was kind of easy because you could say, kind of easy, I never said that about COVID. It was kind of easy because you could say, someone's going to be out for 5 days, and so you could kind of project what does
Right.
tomorrow look like. When it's influenza, someone may feel better tomorrow, I'm back at school. And so you're kind of, we're making our way through. We're going to hold the course right now. We'll obviously keep a close eye on things. But just to make you aware that it's something that we're kind of, we're closely monitoring right now.
There were some things that we did, some prevention factors like wiping tables down and doorknobs between classes, and I know that's such a pain, but at the same time,
Yep.
there are things like that that would be
Hand
too much to ask.
sanitizer.
I mean, even students will do that,
Mhm.
Yeah,
Mhm.
those are
Those
good.
types
Those are
of
hygiene
things,
practices.
those are
we're
already
in.
happening.
Yep, 100%.
Yep.
Yeah. We are still increasing our ventilation beyond what their recommendations are. We are not running it at the full bore as high as we could, as we did for kind of the last 2 years. But it is increased still, but there is a risk when you run those HVAC systems at high levels all the time. You're really hurting the life of those units, and so we just kind of had to find that middle ground.
Mhm.
So but they are still running more than the recommendation. I guess what I'm trying to say. They're not. In Marshall Middle School, when they're running full blast, it's like a wind gust going down the hallway. You can feel.
Yeah.
It's a vacuum. So we're not there right now.
That's good.
So, anything else? With that, any questions? Okay. Turn it over to our students.
All right, well, starting off with the sports report, it's still pretty short right now. All winter sports are in session now, and they're all in preseason, getting closer to the first games in the upcoming weeks. I know varsity hockey has their first game this Saturday. Boys JV and varsity basketball played their first preseason game last night against Oyster River. On to Student Gov. This afternoon, we had a meeting with Mr. Hoogterp. We talked about the midterm schedule. And our wellness committee wants to do a hawk block day the following Wednesday in the 80-minute period to de-stress from midterm, whether that be, we're still trying to figure out the whole detail of it, but whether it be a movie, some games, just to rewind from the stress of the tests. We talked about revising the policy for students being able to come in late and leave early from school as well. Right now, that's only an option for seniors. The school dress code and consequence policies are being revised by the policy group within student government. That was talked about with Mr. Hoogterp as well. As you know, Meg Martinson got a grant for flexible seating for the Learning Center, and now the Student Gov is working, hoping to get a grant from the MEF for flexible seating school-wide within classrooms, pods, hallways. A talk with Ms. McGlinchey about putting on Fun Dress Fridays. I don't know if you've seen the signs. There's one on the door over there. This week is Flannel Friday. Next Friday is going to be your ugly sweater day, and then next Thursday before winter break, it's going to be Purple Day. Purple and White Day, school color day.
All right, on to extracurriculars. Tomorrow afternoon, the quiz show team, I'm actually repping our jersey, heads to Lewiston to face John Bapst. This filming will air in the spring on a main news channel. If we lose, we are unfortunately out, but we are going to be working hard to win. The civil rights team has been working diligently on department meeting content to present to teachers. The information is in regards to the importance of properly responding to slur usage in the classroom, as well as understanding and recognizing pronouns from student to student. The meetings are going to be scheduled for Thursday mornings when they have their department meetings. 1 to 3 students will present to the departments and field questions that the teachers may have. Seniors and staff are currently voting on superlatives for the upcoming yearbook, which has been an interesting conversation amongst most classrooms, especially ones that I've been in since I am known to be running it. The Interact Club is running a coat drive this week in the lobby, and the spring one-act play had their first meeting today after school, run by resident English teacher Mr. Livingston. As for a building update, December is Art Appreciation and Recognition Month at Marshwood High School. Advisories have been tasked with various activities and competitions that promote the making of art across many platforms: photography, graphic design, film, cookie art, holiday cards, and a mimic of a famous artist. Each grade level was given a list of artists that they could base their work off of, and some examples that I have seen, and one from my advisory, is Mr. Piscira's freshman advisory's Obliteration Fan, which is a take on Yoi Kasuma's Obliteration Room style, and Mr. Johnson's senior advisory's Hawk Painting, a take on Alma Thomas's brick-shaped painting style. I'll have pictures for our next meeting of many more than just that. But other artists' advisories could pick from include Banksy, Kasuma, O'Keeffe, as well as many more. Additionally, students have recently signed up for activities to participate in on December 22nd. For some of the day, these activities will be run by teachers, varying from hot chocolate and games with school counselors, to book club with Mrs. Hemker, to chapstick making with Mrs. Smith, as well as film viewing with Mr. Ozinski and 3D snowflakes with Mr. Bowden. So that is the end of my report.
One last piece. This weekend is our last weekend for the Shrek the Musical. There are shows on Friday, and then there's a matinee on Saturday, and then the final Saturday evening. We are hoping that the 15% attendance rates go up, so we have enough actors and actresses to be able to have the performance. Yeah. And so I will be there on Saturday afternoon. Looking forward to it. So we still have time. And that concludes my report.
Thank you.
Can I ask what flexible seating means?
So they're talking about like bean bags, benches in the hallways, just kind of something other than chairs. I know they're talking, have you ever seen like the bouncy chairs?
Yeah.
Just something other for students sit in more comfortable, can help with hyperactivity, moving, other situations like that.
Great, thank you.
Okay, that brings us to correspondence. And while we haven't received any that was directed at the board, I did want to mention a piece of correspondence that I got personally, if the board will bear with me for a moment. It was a solicitation for a contribution from Equality Maine, and it came in the form of a testimonial from a high school student who talked about their experience with the Equality Maine's New Leaders Project and the New Leaders Camp, I'm sorry, I want to make sure I get that right. This person attended this camp, and it made a tremendous difference in their experience of where they were in high school and where they were in their life. It was really, I thought, profoundly moving, really well written. And when I got to the bottom, I looked at the picture and I said, hey, wait a tick. I recognize that person. It's our own Annabelle Taff. So, well done, you.
Thanks.
Yeah.
Can we pass it around?
Oh, sure.
Thanks.
Absolutely. And that's it for correspondence. Brings us to the report of the committees. F&F did not meet since our last meeting and will meet next on the 21st. Please.
So when we met the last time in November, we talked about these usable energy solar projects.
Yes.
I just want to remind that will be part of that upcoming agenda. I wanted to make sure that Heather had an opportunity to hear the work that we had and the research that we gathered around that. So we'll re-present some of that information again at the next meeting.
Okay,
Okay?
sure, okay. Very good. Next is Ed Policy, which did meet on the 30th of November, and we have some first readings tonight as a result of that. Does anybody want to give an update on Ed Policy?
I will give the update
Thank you.
tonight. So we first reviewed the transgender and gender expansive students procedure. There was a pretty lengthy discussion surrounding this policy, which highlights the increased emphasis of the Maine Human Rights Commission in protecting the LGBTQ plus people. So we're beginning to incorporate the feedback that we received from the students and the advisors. That was a really great, productive meeting last month. Also, as you can see on the agenda, there's a couple of first readings, so there was just a few changes in policies that were made to reflect some legal changes. And then we started to take a look at 2 other policies that we'll have to revisit because we ran out of time, so we'll be addressing that next meeting.
I would add,
please.
when we had our workshop with our representatives, one of the things we did talk about was the awkwardness that currently exists in the language in state law. And I'm sure that that's one of the things that the students
Right,
have pointed out
Right.
around things like incorporating gender identity as part of sexual orientation, which it is not. It is orthogonal to that. So they're aware of it. They're going to go back and look at that as well. They're
Yes.
hopefully, I mean, it's not like the Maine Human Rights Act needs wholesale changes, but the language certainly needs a little work. Anyway,
Thank you.
thank you. So we'll look at those first readings under new business. Great. And then thirdly, the Wellness SEL Committee met earlier this evening. But I'll just send that way if anybody on this side of the table wants to see it. You've probably seen it already.
Yeah, quite a bit.
Jen, do you want to talk about wellness?
Sure. So we met briefly just to sort of debrief about Stephen Quinlan's presentation a couple of weeks ago. We sort of said, you know, we were happy with the turnout, especially for our first go at something like this, and definitely feel motivated to do something more and think about what the next steps are, what the next topic could be. Definitely seems like people are willing and ready to start to gather and connect again, and we want to just carry on that momentum and keep brainstorming about what's next.
That's great. Thank you. Anything else on Wellness SEL? Okay. That concludes the report of the committees and brings us to new business. May I have a motion, please, with regard to policy AC?
I move to approve the first reading and discussion of policy AC, non-discrimination, equal opportunity, and affirmative action.
I'll second, Lisa.
Thank you, Lisa. So it looks like we've beefed up a little bit the definitional language around traits that associate with race.
Correct.
The,
Particularly, you know, it was hairstyles was a big
Sure.
part of that, and that's all the big ones, the big state law changes.
yep,
And all 3 policies that we're talking about are all based on the same thing. So if, for example, says for the purpose of this policy, race includes traits associated with
Okay.
race, including hair texture, afro hairstyles, protected hairstyles, including braids, twists, and locks. The other part is the perceived race. They've added that perceived language in there. And
Yep.
so the 3 policies that we're going to go over this evening, or you'll vote on this evening, all have those same basic changes as
Yep.
emphasis.
okay.
So why do we have why would we say afro hairstyles? Why don't we just say hairstyles?
That's language from the Maine state law.
Oh,
So the Maine state law has changed to say.
wow. Yeah, I wouldn't think they would use that anymore.
There's a few things that were like,
Mm.
yeah, I know.
We had asked the question about headwear in general. You know, why is that not included as well?
Oh, yeah,
You know, so,
right,
you know, or face coverings for that matter, of just,
Mhm.
you know, being,
Turban
you
or,
know,
Yeah, yeah.
so
Hard,
just.
yeah.
So,
It's not very.
Yeah.
Okay, any other comments or questions on this specific policy? All in favor? That is 5-0, thank you. May I have a motion, please, with regards to ACAA?
I move to approve the first reading and discussion of policy ACAA, harassment and sexual harassment of students.
Second, Rebecca.
Thank you. So, same comments, any questions? All in favor? That is also 5-0. And thirdly, ACAB.
I move to approve a first reading and discussion of policy ACAB, harassment and sexual harassment of school employees.
Second, Heather.
Heather, thank you. Again, any questions beyond what we've already discussed? All in favor? 5-0, thank you.
May I just have one other
Please.
point, I'm sorry. We also reviewed two of the procedures
Mhm.
as well, so ACAA-R and ACAB-R. There weren't any changes, but we'll put them back in that 5-year cycle, so we have covered those, we don't have to come back to them. The reality is, these three policies have changed, I believe, every year for the last 2 or 3 years, and so these are constantly updated, so this will not be the policies again.
Right.
Right.
For 4 or 5 years.
Yeah.
Yep.
Very good, thank you.
Maybe with some of those changes that we think. That's good, it's good feedback.
That concludes our new business and brings us to the building administrator's check-in. Who wishes to go first?
And I always remind me that 1, 2, 3 jump and someone goes first.
Yeah, I have 2 things. One thing, next Tuesday will be our first Nutcracker back in live instead of virtual. From the last time was 2019 that we had it in person. So we're really excited to be back and have 2 performances, and our PTO sponsoring a staff cast party after with hot chocolate and cookies in the cafeteria. So come see the amazing Nutcracker. Rachel Moore does such a wonderful job, and she's just so excited to bring it back. And also with normalcy, our Hawk Buddies started again this week. We haven't had that in a very long time also. So nice to see our former students back in our building, and it's really talking about connection and matters. I mean, we really try to choose students that sometimes some of your most at-risk students have a lot of adults in their lives, so we try to get match students that might not have a lot of connections, or might have something that, a big family or different things that you feel like they need a voice, and it's a very thoughtful process to match the students, but so fun to see the high school students back in our building. So those are some exciting things.
Thank you.
We also welcome the Hawk Buddies back to Elliott Elementary School. It was really neat to see them interact with the little guys and gals. And, those big eyes were watching those high school kids. It was fun to watch. I've got a couple of things. Consistent with the school district's emphasis on diversity, equity, and inclusion, I wanted to share with you that in Mr. Nesbitt's class, the class created a video on an article called Amazing Work of Disabled Artists, and shared the video with schoolmates and members of the MSAB community. That came out on the Good News. You may have seen it. The voices of our students were passionate as they introduced the various artists. In addition, the students worked with Ms. Chamberlain, the art educator at Elliott, in designing and posting the bulletin board that celebrates the day of welcome. If you haven't had a chance to view those videos, they are absolutely precious. The passion that they speak about each of the artists was incredible. Next piece, we welcomed a member of the Cromwell Center, which many of you are familiar with. Cromwell Center worked in partnership with Bess Kiernan, our school counselor, and engaged our first, second, and third grade students earlier this week. The experience provided the elementary school students with an opportunity to actively participate in interactive hands-on activities designed to further develop students' knowledge of the following. And I'll really place emphasis on the active involvement. To listen to the kids and the observations that they make of the people in our school and family members. talking about a variety of disabilities that they understood to be different, but unique. And I chatted with one of the students, and I always have, I'm really reluctant to use the term disability. It's about a unique ability. And I feel passionate about that, as our kids did. I'm so proud of them and the work that they did with the Cromwell Center and Ms. Cameron. The last piece, I'm really happy to let you know and the community know that Wreaths Across America Convoy will come back to Elliott, Maine. They'll be driving down 236 and down Beach and then down State Road. And we will have a gathering at 1:30 in the afternoon at Elliott. I really want to say how much we appreciate the work of Commander Melvin Bates and Ann Schisler for the planning and organization of this, in partnership really with the Worcester family from Columbia Falls, Maine. Student involvement will involve the national anthem by the Marshwood High School Quintet led by Mr. Gratian, very much appreciated. There'll be a Pledge of Allegiance done in sign language, facilitated by Jan Saramona with our third grade students. What is a patriot? Some of the third graders will talk about that and introduce that. And then the Wreaths Across America song led by Marissa Armitage, our music educator. She'll be working with second grade students. So if you have a few minutes to stop by, it'll be a great day for us.
Which day is that?
That'll be the Monday the 12th,
Oh, that's
starting at 1:30.
This coming Monday.
This coming Monday.
If you want to, like,
At 1:30?
it is, like, convoy is an understatement, like,
Yes.
a lot of people. So, if you want to go, I would probably plan on being there by 1:45 or so,
Okay.
just to get a parking spot, because they're going to close everything down, so
Okay.
it's impressive.
It's going to be a really great day.
And Dr. Harrison, I believe that our students wrote the Wreaths Across America song, correct? That was done in one of our classes a few years ago?
Yes, I believe so.
Yeah, so they-
Yes, with a
Wow.
former
That's
music
cool.
I don't
educator.
think I've heard.
Yeah, really impressive.
That's cool.
And the kids, I was doing an observation in the classroom the other day, and two little girls stopped me and asked me if they could sing the song to me. And they've been really practicing at home, they said. It was just precious.
Oh, that's
Yeah.
cute.
So,
Thank you.
Thank you.
So did the festivities happen at, I'm so embarrassed to say, I've
Yeah.
never been able to make it. So is it at Elliott Elementary or?
It'll take place in the gymnasium.
At the elementary school?
It will open up at 1:30.
Got it.
So we've encouraged members of the community to stand along 236 and State Road and wave. There'll be limited capacity certainly
Of course.
in the schoolhouse.
That's
We'll have
true.
all of our students in there.
That's true. Yeah.
Yeah.
Got it. Thank
Like,
you.
there are police officers from, like, Delaware, Washington DC,
Yeah.
New Jersey, and, like, from, Falmouth. I mean, it's
Yeah.
really impressive.
It's amazing.
You're really proud
That's
moment
cool.
for us.
Yeah.
Speaking of proud, before I came to the meeting today, I was like, okay, what am I gonna talk about when I have to do our little snippet here? And it's just proud of our kids, first of all, and our staff. And so I started just going down through what's happened since the last time that we were here back in November, for the Great Work School. And it is just amazing. I mean, once in a while, we teach math and spelling and reading, but there's a lot of other things that go on, all right? So remember that, making sure that the content's out there, but it's that connection. So like we had our Veterans Day assembly, which was back in person, which was just amazing. We did the other day, we worked with the cafeteria folks, and we said we wanted to start for Pinkham Notch, our family style eating. And so we rearranged how we were gonna eat lunch in the cafeteria where the food was on the table. And so kids have to say please and thank you and things like that. We've got our walk to school, which we do, every third or fourth Friday. We used to have the sleepover in December, so we're saying, well, we're not quite going there yet, but we're having a kids' night out. So we're having kids come next Friday, I think it is, from like 7 o'clock or 6:30 to 9:30 at night, bonfire activities and things like that. And you couldn't, when I say proud, I mean we've got 100 kids that are coming, 150, but you couldn't do that without staff. And they're volunteering to say, okay, on a Friday night, let's do these things. We took at BA, they had the art gallery of the 29 Mainers. We took the entire school up to that, which was just so powerful. So I even wrote these things down here, so I forgot a couple of other
You
things.
just want to write them down too? I'm impressed even more.
We've got the community and we've got the holiday boutique coming this time, which we have not been able to do, where we raise $2,000, $3,000, $4,000, and then we just turn that back to the community. And again, we got some of our retired teachers coming in tomorrow. They're gonna run the show. Just all the clubs. We've done the food drive. We even have 2 classes that have adopted a cow. Okay, and so it's part of the Northeast, the study of the Northeast. And so they've adopted a cow, 2 cows in Turner, Maine. And on like a Friday afternoon, one of the teachers came to me and said, Jerry, can we get a bus to go to Turner? I said, yeah, right. There's no way we can do that. But I said, I'll do due diligence. I called Heather, and we got a bus to take 2 classes to Turner, Maine, so they could go through this entire, what is a farm like? It was great because it is Oakhurst. Their milk goes to Oakhurst, But it was just, but again, here is where the transportation department is just, Dave Gracia would tell you, driving a bus yesterday, it is just, keeping it together with elastics. And they said, yeah, but we'll get your kids to see 2 cows. I just thought it was awesome. And
Did they get to meet their cow?
yeah, they get their own cow. So every month they get, how much it weighs and all that type of thing, get pictures and things.
Oh,
And then we, our Kool-Aid group, I went with them the other night, and we went over to the wildlife, the Refuge Wildlife Center. We got a tour of that. So I kid about the math and science and things like that, but there are so many other things, and that's not just Great Works. That is all the schools. So you have to just be so proud of our kids and our staff.
Thank you.
Thank you so much. Any last thoughts from any of the board? In that case, I'll entertain a motion to adjourn.
I move to adjourn our meeting tonight.
Oh, yeah, then I second, Heather.
All in favor?